primary care is an innovative alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Maryal Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. As we are approaching 2025 and people are planning to open their DPCs or they're in their early days and already realizing, oh my goodness, I might have something in terms of tech, and in our case, in our conversation, we're going to focus on the EMR that might not be working the best as I grow my practice. And so this conversation is so relevant to the end of the year, but also the beginnings of a new one. So with that, Dr. Alex Foxman, thank you so much for joining us today and sharing your experience as a physician who has multiple branches of his private practice and who is a DrChrono user.
Thank you for having me. Appreciate it.
So let me ask, because this is a physician story-centered podcast, tell us a little bit about your journey into opening your private practice. Were you employed before opening up your own practice?
So I was never employed in the realm of medicine. I've had lots of jobs before in college and so forth, but not being a physician. So I graduated in 2003 in internal medicine. Don't want to date myself, but yeah, that's how long I've been in practice. I'm double board certified in internal medicine and obesity medicine. Currently, there's a very small percentage of physicians who have double board certification in those particular fields. The reason I went into primary care, internal medicine, and also private practice was really, I've always wanted to have autonomy. I always wanted to have growth. And I really wanted to always be the captain of my ship. And I think that's very important. There are people who find value in being employed. You go to work, you do your job, you leave, you don't have to worry about the rent and the employees and if the toilet backs up or the supplies are out. But there's a lot of, I think, for me, fulfillment to be able to really write the story for my journey. And starting from scratch was very difficult, but ultimately I think that it shows a very good progress for most people that go into private practice, but also there's a lot of fulfillment in that as well.
And I am going to guess that pretty much everyone who's listening is shaking their heads, especially if they're physicians, because this is why people listen to the My DPC Story podcast. The idea of physician autonomy exists is very much alive and well on every single episode in this podcast. So I want to ask you there, because I think about not only were you focused on autonomy, but you're also a primary care physician. What was it about your personality, your outlook on business that made you really honor the search for autonomy through the way you practice medicine going forward?
Yeah, primary care gave me the ability, one, is to be able to be part of a lot of different parts of medicine. I didn't have to just concentrate on one specific thing. I could really spread out and really be flexible in a business sense with what I'm doing as well. And that's the way I've kind of looked at things. Look, primary care were dinosaurs. Many times private practitioners are dinosaurs. It used to be that the majority of physicians were private practice physicians, but now less than 30%, I think, nationwide are private practice and shrinking. And that's because we're being really pushed out by corporate medicine. Everyone is just a cog in the wheel, just a number sitting on a seat. And I never wanted my patients to feel that way. And I felt the only way to keep control was to go private, was to provide very high quality care. Unfortunately, that has financial downsides to patients as well, because that is a more costly care for the most part. But when you look at it from a large perspective, actually you save money. I'll give you an example. By spending a lot of time with patients, the right time, you decrease the amount of referrals you do. You decrease the amount of hospitalizations, ER utilization, urgent care utilization, medication utilization. And it's clearly shown that we could definitely benefit populations by spending more time with them.
Absolutely. It makes me also think about when it comes to EMRs, DrChrono, which we're focusing on today, is definitely used by specialists, gastroenterologists, podiatrists. But you are a primary care physician, and I would assume that you, of all people, are really going to appreciate all of the different aspects of how an EMR can help you get that job done.
Yeah, I consider myself an early adopter of EHRs, EMRs. I started off right when I came out of residency. I went to our local hospital, which is Cedars-Sinai Medical Center. I went to their chief information officer at the time and said, "What EMR are you using for your outpatient clinics?" And at the time, it was actually GE Centricity, which was a big EHR at the time. So I said, okay, great. That's what I want to do. I want to be connected with the hospital. My vision is that everyone's going to be connected. Everyone was still on paper at that time in 2003, believe it or not. And I said, I want to do this. And I spent a huge amount of money, even before I opened my doors, to put the system together. Now, back then, to have Centricity EHR, it took about 8 servers in my office, separate servers. It took tape backups. It took a tech person to oversee this. You had to do your own updates. If it crashed, you had support that would take many, many hours of your day. And it wasn't very customizable. And every little thing cost a huge amount of money. Every little tweak cost a huge amount of money. So it was very, very frustrating. And I unfortunately used that system for almost 12 to 15 years of my career, struggled with it, went to the office on the weekends to do backups. It was insane. And why did I do it? Because I felt as if I was shackled to the system. I felt as if there's no way out of it because we already had so much data in the system. We had so much experience. I thought this was a way for me to save time, but in reality, it actually wasted a huge amount of time and thousands, not only of dollars, but thousands of hours of my resources to get this thing going. When we transitioned over to DrChrono, it completely changed the paradigm of how we ran the practice. First of all, there are no more servers. Everything is cloud-based, which is very, very important. So all of the tech support and all of the bugs and all of the backup, everything is done somewhere else by someone else, and that's incorporated in the cost. You have a lot of customizability. So we're able to customize our particular practice to the way we believe we should document, the way we should reach out and speak with our patients or educate them, the way we should bill for the patient services, the way we should interact with the rest of our staff. All of that is something that we were able to customize. So DrChrono now sits as the heart of our practice. And there's many times where it was so funny before, if I had to give an order to my staff, I would have to actually run through my office and say, go draw the blood, go do this. We do this now through DrChrono. So it's a much more efficient means of doing things. And because DrChrono works on so many different platforms, there's a huge amount of mobility and opportunity to be independent that I've never had before. I used to have to drag a laptop around with me. Now I could either have a tablet, I could have my iPhone, I could be out in the field or elsewhere and feel as if I'm in the office being able to do things. So it gave me a lot more autonomy, a lot more freedom, a lot more opportunity to really enjoy my life outside the office.
You mentioned how you didn't think that there was a way out. Had you looked at other softwares, and what was it that made you say, yes, I'm going to change, and yes, I'm going to change to DrChrono?
Yeah, so a couple of things. One is that our servers were becoming outdated. There's more security flaws that were being shown. And I knew that it's only a matter of time until either the servers failed and I was going to have a major problem, or I was going to get hacked or whatever it might be. So I knew that I had to make a change. I started doing a lot of research on different types of EHRs out there. I had a lot of interviews. I did a lot of demos. But the reality is that you're never going to know how your EHR is going to function until you're actually using it in real time, right? You could have a lot of presentations and everything looks fancy and great, but until your data is in there and your patient's data and it's in your workflow, you're not going to know. I picked DrChrono for several reasons. First of all, the cloud-based computing was very, very intriguing to me. The mobile factor of it was very, very important because I have 3 different types of practices. I have a mobile medical practice, a clinic-based practice, and a virtual national weight loss program as well. And I had to have it function in all these different types of environments or customize it to that. And also the price point was very important as well. Cost, and because all of us as private practitioners, we're running businesses and we have to make sure that our businesses are run prudently and that we're not overspending on things that we don't have to. And I think all those things together gravitated me to DrChrono. Also the open access. So I knew that others could come into partner with DrChrono and be able to integrate through APIs, which is quite interesting and novel.
What you said about you got to try it out before you really commit because you don't know your workflow. That's why I mentioned at the very top of the episode that if people are already in the place of, I don't know if this is actually going to work for me, it's because they've tried out something and have found actually this is not going to work for me. So that's okay. That's a total normal place to be in, to be transitioning even early on in one's practice. But also, we just had Dr. Clodagh Ryan, who's been in practice for over 5 years, talk about her transition and how she talked about the reasons why she knew the EHR that she was using was not working for her 3 years in, and she took 2 years to transfer over. When you mentioned the API, I think that is something for people to really take a listen to, because I feel in 2024, when we're recording this, that if you have an open API, you are definitely welcoming innovation and you're welcoming a progressive approach to the future. Because as we know, we have wearable devices, you're running a national clinic as one of the branches of your practice. You need to be able to have accessibility for your patients, no matter in what form of practice you're doing, fee for service or DPC. And I think that when you have an open API, that just screams, we are progressive.
Absolutely, 100%.
When you talk about the three branches, I want to go into a little bit more detail because
Sure.
I think it would really help for people to understand what type of practice and what spokes of your practice you have going on successfully. And then I want to ask about how you're doing it because, like you said, DrChrono is at the heart of your practices.
Yeah, so we could start with my private practice. It's called the Beverly Hills Institute. It's located in Beverly Hills, California. It is a primary care and preventive care practice. I always want to incorporate preventive care, which is very important. I think patients are left out of their health care way too much. So in my practice, it's very important that patients are involved, they're educated, they're accountable, and they have a direct line of communication to our office at all times, because I think that really provides health. So the way we use DrChrono in that respect is we do use the iPad version. It's been customized by me of how I like to practice, how my staff likes things as well. We use their on-patient portal immensely to educate our patients. We're very transparent. So every time we finish a note, we send that note onto on-patient with links on education so they understand what's going on. And we also send those notes to all of the subspecialists as well, because it's important that we all work as a team. It's very unfortunate when everyone has siloed data and we don't work as a team for the patient. So we work very hard to try to communicate and share that information as well. But I think one of the biggest things that I think impresses my patients is the ease of communication, the education, and also contact with my staff. I think that's very important as well.
I think that especially in DPC, whether you're a micro practice or a person who has staff, the usefulness is definitely something to focus on for the physician, but it is very important to think about it from the patient's perspective, because after all, when they talk to their friends, their neighbors, when DPC grows by word of mouth, it's because of things like this. Exactly. The usability by our patients is so key when people are considering what EMR they're going to use. So you talked about your primary care practice, and then tell us about your home visit spoke of your practice, as well as the national side of your practice that you talked about as well.
Sure. So I also operate a mobile medical practice. It's called Mobile Physician Associates. It's located in Southern California. And we provide medical home visits to the frail, elderly, and disabled population in our area. We have very complex, sick patients. Average age is 86. If anyone knows about what risk scores are, the risk score on average is 4. So they're considered 4 times more costly and more ill than the average Medicare beneficiary. And we do it in a very unique way. We not only provide the medical home visits, but we also provide all of the ancillary services that you could get in a doctor's office directly to the person's home. That includes immunizations with COVID and flu and pneumovax and you name it. It includes electrocardiograms and ultrasounds and sleep studies and Holter monitors and x-rays. So we could do everything that could be done in the office right at a person's home. And we've been doing it quite well. Since 2009, we've seen over 77,000 patients. I believe that is the future of healthcare. It's not about how much can you do to the patient to get reimbursed. It's more about how can you take care of this patient in the best way possible to not only make them healthier, but decrease overall cost for that patient population. So that's the mobile practice. I also started Achieve Health and Weight Loss. It is a national medical weight loss and health program currently in 39 states, completely virtual, where we provide weight management specialty care to patients who need it. As we know, obesity and being overweight are a national epidemic. 75% of all people in the United States are either overweight or obese, with about 40 to 45% being obese. And we've been able to now significantly and successfully manage these patients when we couldn't do that before because of the novel innovations of GLP-1 and GIP medications. But these medications, coupled with a very good program such as having health coaches, having body composition remote scales that send us the information, having physician oversight, has dramatically changed people's lives nationally. And we're very proud of that as well. And DrChrono is used so differently in all these different kinds of aspects. And that's what I love about it, is that flexibility where we could use it either office-based, we could use it mobile, or we could use it virtual.
Just thinking about just the differences between an exclusively home-based option versus office-based there versus totally virtual. The workflows are going to be so different. You have DrChrono for all three spokes of your practice, and not you have DrChrono for one, and then another for another, and then another for your third. So tell us about how you've been able to really customize DrChrono in so many ways, because it's not only all in one, but it has these different aspects of how it can be customized to your practice's needs.
Yeah, what's great is a couple of things. One is DrChrono has a physician sharing network where physicians could develop their own forms and templates and share it with other people. But also they have a built-in, very innovative, and I think pretty good module that allows you to customize your own forms. So you could customize them in many different ways. There's drop downs, there's lists, there's check boxes, there's many different things that you could do. And you don't have to be a programmer to do this. That's what's great about it. If you're able to run Excel, if you're able to do Microsoft Word, do a PowerPoint presentation, you can do this yourself. And the beauty about it is that, again, you now are customizing this for your workflow, for your life. It's not some other programmer telling you how you should practice. It's you doing it your own way. And it's been extremely, extremely beneficial for us in all our different practices, because every single practice is different. Not only my practices, but your listeners out there as well. Everyone is completely different. Every direct primary care practice is different from the other one. Every doctor just functions a little differently. And I believe that having a customizable EHR is amazing, because everything else that we have around us is not. We're kind of fixed into everything that's provided. This is the one thing that we can really make our own and show the care that we provide to our patients through documentation and efficiencies and things of that nature.
And I think that there's definitely going to be listeners out there who are just hearing there's something other than the epic cerners, like the centricities. This is amazing. And yes, these things exist because there are people out there who are thinking about, hey, how could we make this better for our doctors and make it better for our patients? The other thing that I want to mention there is there's people also thinking about how can this be better for our staff? So for those of us who have staff, like you have your office manager at the Beverly Hills Institute, Robin, and I was watching a little clip about how she spoke about how the transition that you guys had to DrChrono was just, she couldn't have had it sooner, was what I got from her testimonial. So can you talk to us about how your staff adopted and was able to work with you as you continued to customize DrChrono?
Yeah, I mean, we could even go back to our COVID days where we were isolated, we were all doing telehealth. There was no real good HIPAA compliant way to communicate during that time. So that's where we really extensively started using DrChrono's task management system and internal messaging to really help us work remotely. Everyone was separate, and we use that to this day in the same way. So orders are put in there, messages are put in there, different tasks for the office, questions going back and forth. It's very customizable also. You could have groups of people that all the messages go to, or individual people. So that the internal communication aspects of DrChrono, I think, are very important. Important in my private practice, but definitely important in my mobile practice, where no one is in the office. Everyone is separate. The ultrasound tech who's on the platform as well could be 10 miles away. The phlebotomist is elsewhere. So you have to have ways to communicate. You have to have ways to document. You have to have ways to be able to have this all in one area. Before, people use email here or Skype there. They use all these different platforms, and it's just impossible to look at all these different things. So having everything in a one hub, in one section where everyone sees the same thing or can see the same thing, I think is very important.
You have memberships. So tell us how that works for both the people who you are billing insurance, but especially the people who you are billing memberships, because there are people who are running hybrid DPCs, and then there are people who are only running memberships.
Yep. My private practice, Beverly Hills Institute, we have an annual fee that we charge all of our patients. We charge them per person. We charge them for family members or additional family members. So we have several tiers that we have. Our fees are either monthly or they're annually. And the fees, people ask all the time, well, what are these fees for? They're the things that all direct primary care and good physicians strive for. Same and next day appointments, longer visits, opportunity to help set up subspecialty care, discussion of the labs when they come in or other diagnostic things, having everything in one location, which we strive for. All the things that patients really envision or dream about is what we try to do, right? So we have our annual fee, but we also bill insurance for services as well. In the Beverly Hills Institute, we use DrChrono for what's called revenue cycle management. Who take all of our notes, they'll take all of the diagnoses, all of the things, and they'll run them through their billing software and build insurances for that. They will then get reimbursement from the insurances. They'll send out statements to the patients to get reimbursement from the patients if there's a copay and so forth. And then all of that will come back to us at the very end as revenue. And they take a small percentage of that revenue for that, but I think it's actually well worth it. For the mobile practice, we don't have a membership fee. We just bill Medicare. And for our Achieve Health and Weight Loss, which is the virtual weight loss practice, it is membership based only. We charge a membership fee, and everything else is included in that fee except for medications, which we try to help the patients reduce costs through a number of different ways, either prior authorizations or other remedies that we have for them to reduce their costs. But that's membership only for that particular practice.
I think that that's important for people to hear, because when you're already going from being a doctor, which is a very hard thing to achieve, to then being a doctor and a business owner, it's a lot. So I think that that's really helpful to hear. DrChrono is flexible whether you're billing insurance or not.
Yeah, I'll tell you, business is definitely not easy. Business is, even though people go to school their entire lives for business, the reality is business is all about experience. And it is extremely gratifying, though your viewers should know that you don't just come out and everything is perfect. Everything always will have some sort of inherent problems and risks and steps backwards with some steps forward. But the reality is that over time, you'll be, in my opinion, much more ahead than behind in regards to where you would be if you were employed. Not just by satisfaction with your work, satisfaction with your family or personal life, with your time for yourself. I think all those things are very important. And by being private, you control all of those things, which is quite good.
When earlier you mentioned about how one of the things that you had said to yourself was, I don't know about switching to an EMR, DrChrono in your case, because I have all of this data housed in the servers of your prior EMR. Do you find that there's particular things that you're able to track that are meaningful versus meaningless, MIPS, MACR, all of these things that there's a lot of arguments about, that help you understand your population of patients and what your population of patients need?
Yeah, first, DrChrono is great, but there's no perfect EHR out there. We just have to be factual. So if people are listening and thinking, oh, everything is perfect, there's no perfect system. But what DrChrono has is a very good team behind it now. It wasn't always like this before, but now it's a very, very good team that listens, that wants to make changes, positive changes, that makes positive changes instead of just talking about them. So there, in terms of analytics, informatics, there are reports and so forth that are provided from DrChrono. They're not perfect, but they're getting much, much better. And what I see right now, the most exciting part about this is the use of AI in the future with analytics and looking at data. Before, when I was with Centricity Practice Solutions, which is Centricity EMR, One thing that I thought was very important is that every single field was labeled on the back end. So in other words, if you ran a report and said, let's look at all of the vital signs for every single patient, everything was in its own little area there, and you could run a report and the back end would calculate that for you. DrChrono doesn't have that. DrChrono more is more like a typewritten report for all intents and purposes. But now with AI, you don't need those fields in the background. AI will actually come in, it will scrape your data, it will read your data, and provide you that exact same information. I really believe, though it's not there today, I believe in the next year, we're going to have a lot of AI integration with DrChrono that's going to really just blow the socks off of most people even today of what it's going to be capable of doing.
And let me ask you there, are there any other things that you are talking to the team about in terms of this would also help my patients and myself and my practice going forward, that you know, like you said, you have the ability to talk to someone who will listen to?
Yeah, I'm part of the advisory board for DrChrono. So we have meetings on a quarterly basis where we submit the things that we believe would benefit DrChrono. I always look at it from the perspective, not to look at things that would just benefit me on a small detail level, but look at the wide range of things that would benefit them. And the advisory board is made up of, I think, 1 or 2 dozen physicians and others, and from all different types of specialties, all around. So it's very interesting to see who requests what. But some of the other things that really I'm interested in is AI scribing. We all just spend too much time clicking away. And if we could have more eye-to-eye contact and just talk to the patients and have an AI scribe actually document this for us and us do some very small alterations, that is really where we're heading. And that really is going to change the relationship with the patients and the doctors. I think every patient complains that the doctor spends way too much time looking at a screen and looking at them. And I think that's very, very wrong. But I think it's going to change very, very soon for the better.
It's interesting because I absolutely have had patients in my own practice, but also patients of my friends' practices who have said, I just never saw the doctor's eyes when I went into their practice. And these are the ones that I'm speaking of, formerly went to corporate practices. And that was their reason for trying DPC out. Like, they weren't necessarily sure about what it is. And they're like, oh, you actually get a doctor to talk with you, not a doctor typing as their mouth is moving, talking to you, but they look at you. So I think this is wonderful. And yeah. I'm really excited for people to hear another option out there in terms of what an EHR looks like in 2024. Definitely check out the link in the show notes, check out the link on the website at mydpcstory.com, and check out the QR code on the YouTube if you're watching. Schedule a free demo to try DrChrono out for your practice. And on that note, I want to ask a last question in terms of when a person is trying out DrChrono, what high-level tips do you have for them to be able to evaluate, is this the right EMR or EHR for me?
You have to look at your workflow, which is very important. You don't want to try to put a square peg in a round hole because it's not going to work. You want to look at ease of use. You want to look at efficiency. For example, I complete all my notes at the point of service. So when I'm done for the day, I don't do notes. That was not the way it was with Centricity. I would have an entire patient population to deal with at the end of the day, which was very frustrating. I think you want to look at the clickable nature and the mobile nature of DrChrono, which is very important, and the ability to take things on the road if you need to. And the customizability. Again, you'll never know 100% until you're actually deep in DrChrono, but they have a lot of different demo opportunities to put in dummy patients and things like that as well. But I think once you try it out, especially the app version on the iOS tablet, you'll see a complete difference than what you would see with all sorts of other very large models like Epic and Cerner.
Thank you so much, Dr. Foxman, for joining us today and sharing your experience as a super user of DrChrono.
Thank you very much.
Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Maryal Concepcion.